This is Shelter Talk. This is our video series where we give you a look behind the scenes at how we operate here at the York County SPCA, and we're focusing on the medical department. And in this video, this is our third video in a 4-part video series, we're going to talk about infectious disease and how we manage the spread of those infectious diseases and controlling the spread. The first thing I want to know, Dr. Weeks, is what are the common infections that we see going around the shelter environment?
Yeah, our most common that we're going to see are upper respiratory infections in both dogs and cats, GI parasites, parvovirus in dogs, and then panleukopenia and ringworm in cats.
Okay, and so then talk about if an animal gets an infectious disease, that's going to extend their length of stay. So how do you think about managing the length of stay in the medical wing?
Yeah, so we need animals healthy for adoption. Yeah. So if they're sick, they're going to be with us longer because it takes time to rehabilitate them. So for example, if a dog has parvovirus, they're automatically with us for a minimum of 4 weeks. Those animals are then taking up kennel space. So it leads us to become at capacity quicker, which then compounds because as the shelter gets full, we have more infectious disease and spread potential.
Right. So what are some other protocols that you and your team go through to keep our animals healthy, or if there is a disease, how do we manage for that?
Yeah, we have a lot of protocols in place to help mitigate the spread of disease. So that is anything from very specific ways to clean, to vaccinating on intake, how to monitor the population for illness and running specific tests. If we do have an illness that breaks out, we have additional cleaning protocols. We have isolation and quarantine procedures. And it's just part of the medical team's responsibility to protect public health through disease surveillance, testing, and treatment.
Right, totally. And you have another tool in your tool belt, right? So if we do have an infectious disease or to control the spread of disease, we have volunteers and foster programs. And so we have vulnerable populations of animals here at the organization, and we can activate our volunteer network to help manage that vulnerable population. So talk to us about what is an example of a vulnerable population that you see a lot of, and how can our foster families support that vulnerable population?
Yeah. So as the shelter gets full, we're going to have more infectious disease. So it's really important to get animals out of the shelter and into a foster home. And that's especially important for very vulnerable populations like our underage kittens. So their immune system is not developed yet. So it's important to get them out of the shelter. We also have some select individuals who will actually foster animals who have contagious diseases. So just like people, animals are going to recover faster in a home environment. They're going to be socialized better, and it helps us prevent cross-contamination with our general population.
Okay. So one way that the community can support your work is by raising their hand and be willing to be a foster or a volunteer. All right, so that concludes this video, and I just want to point out that the fact that Dr. Weeks and I are wearing York County SPCA merchandise. If you want to support our work here at the York County SPCA, please purchase our merchandise, and you can do so by clicking on the link that is in the description of this post.